Hello everyone, we are Group Z1. Our group members are Ksenia Afanasieva, Maria Fernanda Reyes, Lilit Tovmasyan, Anastasia Chesnakova, and Alla Voskanyan, and we're going to talk about the physiology of cocaine.
Cocaine is a naturally occurring chemical found in the leaves of coca plant. It is a highly addictive stimulant drug that directly affects the nervous system. Cocaine processing involves many chemicals, and it is often mixed with other substances. Some of these substances are extremely dangerous. People abuse cocaine in two chemical forms. The first form is cocaine hydrochloride. This is a hydrochloride salt. It comes in a powder form and is able to dissolve in water. The second form is a base form. Depending on the method of production, the base forms are called free base or crack. Cocaine is absorbed in both forms. People take cocaine intranasally, intravenously, and by inhalation. The duration of euphoria depends on the route of administration. The faster the drug is absorbed, the more intense the resulting high. Injecting cocaine is the fastest way because it's released directly onto the bloodstream. Cocaine makes the user feel euphoric, energetic, talkative, and hypersensitive to sight, sound, and touch. But what exactly is happening that leads to this euphoria and pleasure? In order to understand how it works, let's take a look at this picture. Cocaine, as many drugs, interfere with the events at neuromuscular junction. It increases levels of dopamine at the synaptic cleft. Dopamine is a hormone associated with happiness and pleasure. On the left picture, we can see how process normally goes. Normally, dopamine is released into the synaptic cleft. Then it binds to the specialized protein called dopamine receptors. By this process, dopamine acts as a chemical messenger and transfers a signal to another neuron. Here we have another specialized protein called dopamine reuptake transporter. Transporter removes dopamine from the synaptic cleft to be recycled for further use. On the right picture, we can see how cocaine works. If cocaine is present, it attaches to the dopamine transporter and blocks the reuptake of dopamine. A build-up of dopamine in the synaptic cleft produces an amplified signal to the receiving neurons, which causes the euphoria. In addition to dopamine, cocaine prevents serotonin and norepinephrine from being recycled as well. In addition to these effects, cocaine can also act as an anesthetic. Like other local anesthetics, it produces direct effects on cell membranes. Cocaine blocks sodium channels. If the sodium channels are blocked, this prevents polarization and therefore prevents the generation and conduction of nerve impulses, such as the transmission of pain signals.
Cocaine's effect on the heart. Cardiovascular symptoms are the most frequent complaints in cocaine users. Up to 25% of non-fatal heart attacks in adult age 18 to 45 are associated with a regular cocaine use. Cardiovascular effects of cocaine are caused by inhibition of norepinephrine reuptake and by inhibiting ion channels such as potassium and sodium channels. The exaggerated sympathetic activity increase the force of contraction, raise the heart rate and the blood pressure. All those increase myocardial oxygen demand. At the same time, norepinephrine trigger vasoconstriction and reduce the blood flow. This is very bad combination. The cardiovascular symptoms becomes extremely stressed. Arrhythmias is one of the common effects of cocaine. This is a condition in which the heart beats with an abnormal rhythm. We know that cocaine inhibits cardiac ion channels. Because of the sodium channel blocked, the upstroke of action potential is deleted. Increased heart rate and the acidity boost the effect of cocaine on sodium channels. Cocaine effects on potassium channel result in prolongation of QT interval, early after depolarization and ventricular tachyarrhythmia. Cocaine use can also cause severe spasm of arteries. Coronary artery spasm is temporary constriction of the muscle in the coronary arteries. A spasm can decrease or completely block blood flow to the heart. It may lead a heart attack or even death. Myocardial infarction is another complication. It can occur with any dose and even in first-time users. A heart attack occurs when the flow of blood to the heart is blocked. After cocaine is ingested, your heart will begin to beat faster. At the same time, cocaine nerves the blood vessels. This puts a lot of stress on your vascular system and your heart is forced to pump harder. As a result, your blood pressure will increase. All this increases myocardial oxygen demand. At the same time, cocaine decreases myocardial oxygen supply via coronary vasoconstriction and platelet thrombosis. If myocardial oxygen demand exceeds myocardial oxygen supply, it results in a myocardial infarction. The increase in pressure and extra stress on the heart muscle can lead to a sudden tear in wall of your aorta. This is called an aortic dissection. In young people, cocaine use is a prevalent cause of this condition.
Cocaine's effect on the respiratory system. The respiratory system's principal function is to deliver oxygen and remove carbon dioxide. The usage of cocaine and its damages. So the usage of cocaine can lead to hardening of the cellular walls in organs like the lungs and death of cells in the respiratory system. Snorting cocaine is how the drug's full effect is felt longer. In order for the cocaine to take hold, it must enter the bloodstream and flow to your brain. As you inhale the cocaine, it coats the soft tissues in the nose and gets absorbed into the bloodstream. To make it to the brain, the cocaine flows in the blood and as it's being absorbed, first traveling to the lungs. The lungs incorporate oxygen in the blood. Remember, the alveoli is where the gas exchange occurs. And then send it to the heart to be pumped to the brain and the rest of the body. Once in the brain, cocaine binds to certain receptors and guarantees that dopamine, the feel-good chemical, isn't being removed as it normally would be. Snorting in particular affects the tissues and the nose directly. If cocaine use becomes regular, soft tissue damage will progressively worsen, as early symptoms is a runny nose, indicate of sinus infection, which can be a result of the drug itself, or dirty environments and tools used when snorting cocaine. It can lead to loss of sense of smell, nosebleeds due to the damaging olfactory nerve and respiratory mucosa, which lines the nasal cavity. Cocaine snorting damages the nasal passages and causes significant tissue death, increased risk to develop nasal infections. This is one of the reasons why users develop consistent nasal congestion and overall irritation of the nasal septum, leading to chronic inflamed runny nose. Systemic necrosis is one of them. It also occurs. It's a condition in which there is a loss of blood flow to bone tissue, which causes the bone to die. It is due to shortage of oxygen that is needed for cellular metabolism to keep tissue alive. This causes deterioration in the nose and nasal septum. Bronchoconstriction, which is the parasympathetic stimulation that reduces the luminary diameter of the airways, which increases resistance to airflow. The constriction of the airways in the lungs tightens the surrounding smooth muscle, causing consequent coughing, wheezing, and shortness of breath. Excessive parasympathetic stimulation can almost completely prevent airflow along the terminal bronchioles, such as asthma. The term cracked lung refers to acute pulmonary syndrome, arsenic pneumonia,
It occurs after the inhalation of cocaine or freebase crack cocaine. It is a rare disorder characterized by a rapid accumulation of eosinophils in the lungs, pulmonary eosinophilia. The eosinophils are white blood round cells with a bilobed nucleus, and its cytoplasm contains large granules. They attack objects coated with antibodies and dramatically increase during an allergic reaction or parasitic infections. Lung tissue specimens obtained in affected patients reveal diffuse alveolar damage and alveolar hemorrhage with interstitial and alveolar self-infiltration rich in eosinophils. Pulmonary complications can cause use depend on the method, administration dose, and frequency of use and presence of adulterant of substance. The most common pulmonary complications of cocaine are pulmonary edema caused by excess of fluid in the lungs. Hypnotisis is a cough up of blood and blood-stained mucus from the bronchi, larynx, trachea, and lungs. Hypoxia, the body or the region of the body is deprived of adequate oxygen supply at the tissue level. Pneumothorax, when air leaks into the space between your lung and chest wall, this air pushes out on the outside of your lung and makes it collapse. Bronchiolitis obliterans becomes damaged and inflamed by chemical particles of respiratory infections, and hypersensitivity pneumonitis, causing inflammation and swelling and sensitivity of the lung tissue. There's also pulmonary hemorrhage and thermal injuries to the airway that are the most common of cocaine usage.
As we mentioned, cocaine is bad for your health. It affects your entire body, including your skin, the largest organ in the body. Effect will be more pronounced if you use cocaine long term or in large amounts, but even occasional use can have an impact. Cocaine is vasoconstrictor, meaning that it reduces the blood supply to cells, reducing their levels of nutrients and oxygen, and as a result, it damages the white blood cells, leading to skin necrosis. Here is the difference between apoptosis and necrosis. All cells undergo growth and death. Cellular death is essential for an organism to grow and survive. There are two ways in which a cell undergoes death, either through exposure to harmful environment or through pre-planned and regulated process of disintegration. Cell death occurs via two different processes. One is necrosis, other is apoptosis. What is necrosis? Necrosis is a process of cellular death which occurs when cells are exposed to toxins that leads to damage to the internal cellular environment and rapid cell and tissue damage. So the basic inability of the cell to maintain balance when exposed to rough condition leads to complete discard in the cell's functioning and eventually its death. Apoptosis is a normal natural process which is necessary for the body as it maintains balance in the number of cells in the body. If cells don't die in time, it can lead to tumor or cancer formation, which is an accumulation of unwanted cells. If cells die too fast, it can lead to conditions such as AIDS, heart, liver disease. So if apoptosis does not take place as it should, there will be sign of disease. Necrosis is a passive process which doesn't require energy, new protein synthesis, not regulated by homeostasis, and can occur in any point of time. This is a random event which is under-regulated. Apoptosis is an active process which requires energy and occurs in organized manner. Many enzymes and agents are required to carry out various steps of this process. So apoptosis is natural physiological process which is required by the body, while the necrosis is a pathological process which happens from inflammation and tissue damage. What are the symptoms of necrosis? Pain, redness of skin, swelling, blisters, fluid collection, numbness.
Let's start talking about how cocaine use leads to addiction. Cocaine usage over time leads to chemical imbalances. Receptors in the brain become used to cocaine, preventing dopamine, norepinephrine, and serotonin from being recycled. The body recognizes this and therefore decreases the amount of receptors that these hormones can bind to. This is what leads to tolerance, and even more cocaine is required to achieve the same high. As time goes on, more and more cocaine is needed to reach the same level. Cocaine addiction is based on positive and negative reinforcement. Users experience positive reinforcement when they take it for the first time. It gives them the high way above the normal state. The second or third time you use cocaine is due to the reinforcement history. You know that it will give you the high feeling again, so you continue to take it. Later on, you don't get the same high, and it gets to the point where it makes you feel even less than your normal state. This is known as negative reinforcement. Cocaine now is the cause of your negative state, so you begin craving cocaine just to feel normal. This is now classified as an addiction. Let's talk about what happens to the body when you quit cocaine. There are 3 stages of cocaine withdrawal: crash, continued withdrawal, and extinction. The crash phase occurs between several hours and a few days of last use. It is characterized by severe depression, exhaustion, restlessness, and irritability. Some people have suicidal thoughts during this phase. The second stage is continued withdrawal. This is the stage while mood and functioning begin to improve. The person may feel bored or unable to feel pleasure. Increasing cocaine cravings, irritability, and lack of energy may occur during this stage, which lasts 1 to 10 weeks. The risk of relapse is particularly high during this phase. The last but not least is extinction. Intense cravings for cocaine that come and go are common during extinction. Mood swings can persist. This phase can last up to 6 months. Unfortunately, there are no FDA-approved medications that specifically treat cocaine withdrawal. However, there are some promising potential future treatments, including a natural bacterial enzyme called cocaine esterase. This is an enzyme that could help stop the effects of cocaine during an overdose and help treat addiction. It helps to break down cocaine in bloodstream. The problem is that it's only functional for 24 minutes. That is not long enough to treat an overdose or an addiction. Therefore, researchers are trying to add mutations to cocaine esterase to extend the time it can stay functional. The enzyme needs to remain circulating in the bloodstream for a few days, blocking the cocaine high. There is still a lot of work that needs to be done for this enzyme to be used to treat cocaine addictions. Another potential treatment is a vaccine that could help reduce the risk of relapse. The vaccine stimulates the immune system to create cocaine-specific antibodies that bind to cocaine. These antibodies would prevent cocaine from binding to dopamine transporters. However, there are also a lot of work needs to be done. And finally, we would like to finish our presentation by sharing a quote with you. The goal isn't to be clean. The goal is to love yourself so much that you don't need to use cocaine.